Hey everyone! Today I'm going to tell you about Clostridium difficile. What is Clostridium difficile? Clostridium difficile is also known as C. diff colitis. Colitis as in inflammation of the colon. It is a species of gram-positive bacteria of the genus Clostridium that causes severe diarrhea and colitis. C. diff bacteria are found throughout the environment, such as in soil, water, feces, and processed food products. Spores from C. diff bacteria can be passed in feces and spread to food, surfaces, and other objects when people who are infected do not properly wash their hands. These spores can live on surfaces for many weeks or even months. What are the reservoirs of C. diff? The two major reservoirs of Clostridium difficile are infected people and contaminated environments. Since C. diff spores can survive for weeks to even months on surfaces, those feces contaminated surfaces may serve as a reservoir for Clostridium difficile spores. Morphology and features. Clostridium difficile is a rod-shaped, usually straight, but can have a slight curve, and resembles cylindrical rods when viewed under a microscope. When viewing slides of Clostridium difficile under the microscope, it can show shape variations such as short, thick forms and large gram-positive rods with rounded ends. What are the virulence factors? The main virulence factors of C. difficile are two toxins, toxin A and toxin B. These two toxins disrupt the cytoskeleton and the tight junctions of the target cells, which will ultimately lead to cell death. As you can see in the illustration, the C. difficile reproduces in the intestinal crypts, releasing toxins A and B, which will cause severe inflammation. Mucus and cellular debris are expelled, leading to the formation of pseudomembranes. Diseases associated with Clostridium difficile. Clostridium difficile colitis, which can also be known as pseudomembranous colitis. Toxic megacolon, which is widening of the large intestines that can be life-threatening. It usually develops in just a few days, and it is very rare. Perforations of the colon. This is when a hole in the wall of the colon happens. This opening allows air and intestinal material to leak into the abdominal cavity. And then finally, sepsis. It's a life-threatening complication of an infection. Sepsis occurs when chemicals released in the bloodstream to fight an infection trigger inflammation throughout the body. This can cause a cascade of changes that damage multiple organ systems, leading them to fail and sometimes even resulting in death. What are the signs and symptoms? Watery and frequent diarrhea, abdominal cramping and pain, which can be severe, nausea, dehydration, loss of appetite, and fever. Normally in mild cases, you'll just have diarrhea for a couple days, but very frequently throughout the day, and a little mild abdominal cramping. Everything else is for severe infections. Transmission. The primary mode of transmission is spread person to person by the fecal-oral route. This occurs when someone's hands become contaminated with the bacteria and they end up touching their mouth. Then the bacteria enters the body orally. What is the lab diagnosis of Clostridium difficile? The simplest way to detect the C. diff bacteria is by a stool test. You provide a sample of your stool in a sterile container which will be provided to you by your doctor. Then a pathologist will determine if the C. diff bacteria is present. The pathologist will test the sample very quickly as the toxins will become inactive shortly after the sample is collected, which could affect the results. How do you treat this? Clostridium difficile is typically treated with antibiotics. The antibiotics will keep the bacteria from growing, which will treat the diarrhea and other symptoms. The two common antibiotics used to treat C. diff are vancomycin or fidaxomicin. How do you prevent Clostridium difficile? Practice good hand hygiene. Keep your home clean, especially your bathrooms. Immediately clean surfaces of spills and accidents, especially bodily fluids, such as vomit, urine, feces, or blood. And wash your hands frequently. These are some random facts that I found interesting regarding Clostridium difficile. Illness from C. difficile most commonly affects older adults in hospitals or in long-term care facilities and typically occurs after use of antibiotic medications. Antibiotics or other disruptions to a patient's microbiome can allow C. diff to multiply and produce toxins, leading to a Clostridium difficile infection. One common antibiotic that this is regarding is penicillin. The bacterium can be found in the digestive system of roughly 1 in 30 people, but is often outcompeted by other bacteria and kept from manifesting into an infectious dose as a result. The most at risk from contracting a CDI are the elderly, patients of digestive surgery, those with weakened immune systems, and those with underlying conditions such as cancer, irritable bowel syndrome, and kidney disease. Do you think there's a vaccine for Clostridium difficile? Unfortunately, as of right now, there is no widespread vaccine available.